Hey everyone, welcome back to Dietitians and Nutrition Support. Today we're kicking off our parenteral nutrition series, talking about what you might find in your typical bag of parenteral nutrition. We'll discuss all three of the macronutrients, micronutrients, and other considerations you may have to take when you start recommending parenteral nutrition for your patients. Let's go ahead and get started. As a nutrition support dietitian, or a future one, you'll be working closely with IV nutrition, otherwise known as parenteral nutrition, or PN. Understanding PN and all of its complexities can take some time, but having this background will allow for you to provide the best care possible to your PN patients, and these skills are often associated with higher level practice, leadership opportunities, and independence in your work. So let's start off this conversation talking about what's in parenteral nutrition. When we're talking about parenteral nutrition, there's a few different options. The first option we're going to discuss is custom parenteral nutrition. Within this category, you have the opportunity to customize all three of the macronutrients as well as the micronutrients found in the parenteral nutrition solution. There's a few primary options for custom PN. The first choice is called a 2-in-1 solution, meaning there's two macronutrients in one solution. Within a 2-in-1 solution, you'll see the two macronutrients included are amino acids and dextrose. These will provide the protein and carbohydrates needed to your patients. Now you may think, where's our third macronutrient, lipids? Well, with a 2-in-1 solution, you can only provide amino acids and dextrose, but you may see what's called a lipid piggyback added to your patient's parenteral nutrition recommendation. This will allow for them to get those customized lipids just given separately from the 2-in-1 solution. You should note that a 2-in-1 solution is typically clear. A lipid piggyback is oftentimes a cloudy white color. It's important to know what parenteral nutrition typically looks like so you can spot any abnormalities as they arise. The second kind of custom parenteral nutrition we'll see is a 3-in-1 solution, meaning all three macronutrients within one solution. This will include the amino acids, the dextrose, and the lipids. Within this solution, you still have the ability to customize all three of the macronutrients and the micronutrients, but it'll be a little different than the 2-in-1 in the separate lipid piggyback, being that they're all combined together and will have a cloudy appearance. The second variety of parenteral nutrition often seen in hospitals is standard parenteral nutrition. Within this category, we're looking at pre-formulated bags of parenteral nutrition. They often come in different varieties, offering different amounts of calories as well as macronutrients, oftentimes with a standard level of micronutrients. Within the standard parenteral nutrition category, you'll still see a 2-in-1 option that provides amino acids and dextrose, all of which can be accompanied by that lipid piggyback that we previously talked about in custom parenteral nutrition. And you'll also see the 3-in-1 parenteral nutrition that will provide amino acids and dextrose and lipids. Both custom and parenteral nutrition can provide your patient with the nutrition they need for the 24-hour period that a parenteral nutrition bag will typically hang for. Institutions will often determine whether or not they want custom parenteral nutrition or standard parenteral nutrition, but some facilities will offer both. For facilities that create custom parenteral nutrition, they will have to have a sterile environment for all of the custom parenteral nutrition to be compounded together into the parenteral nutrition formula. This solution is typically made in the pharmacy. If your institution has custom parenteral nutrition that's compounded within the facility and you're interested in seeing how that works, I encourage you to ask the pharmacist if you might be able to observe the process. Whether or not your hospital has custom or standard parenteral nutrition will be based on what they've selected to provide to their patients. Sometimes you'll see just custom or just standard parenteral nutrition available, and at other hospitals you'll see both. Make sure to take some time to get to know what your institution has available so that you can make those recommendations for your patients who may be in need of parenteral nutrition. So let's start chatting about what macronutrients we're going to see within our parenteral nutrition and what they can provide to our patients. The first one we're starting with is protein, also known as amino acids. Within parenteral nutrition, the protein provided to our patients will be given as amino acids, and thankfully for us, it is concocted to be the perfect balance of all essential amino acids to ensure that your patients get just what they need. Similarly to an oral or an enteral recommendation, you'll see that the amino acids provided through parenteral nutrition are also 4 kcals per gram of protein. This allows you to make a pretty easy calculation just as you normally would for your patient's protein recommendations. Although standard bags do not allow you as much opportunity to customize the amount of protein provided to your patient, you will be able to see a total number of protein grams within the solution that you'll be providing. Within custom parenteral nutrition, you'll see that there's an opportunity to select from a variety of solutions that each contain a different amount of protein in grams based on their concentration. For example of this, you might see a 25% amino acid solution, which actually equals 250 grams of protein per 1 liter of solution. So you can make your own recommendations of concentration as well as volume to ensure that your patient gets the right amount of amino acids in their parenteral nutrition. Alright, let's move on to carbohydrates. When we're talking about carbohydrates provided in parenteral nutrition, they're a little bit different than the carbohydrates you might consume orally or enterally. Within this solution, specifically, we'll be using dextrose. Now, while dextrose can provide carbohydrates to your patient, just know that the calculations are a touch different because dextrose is not the typical 4 kcals per gram of carbohydrate, but it's actually 3.4 kcals per gram of dextrose. Just remember this one when you start to calculate because it's often forgotten. Similar to protein, you'll see that the amount of dextrose you can provide in a carbohydrate solution can differ. So you can offer different concentrations, which would allow for different amounts of grams of dextrose depending on the volume that you provided. For example, we might see a 10% dextrose solution that would equal 100 grams of dextrose per 1 liter of solution. So working with your math there to try and figure out how many grams of dextrose they need, you can determine an appropriate concentration of solution and then in turn an appropriate volume to provide to your patients. Our third macronutrient is obviously lipids. When we're talking about lipids, we may be considering the lipids within a 3-in-1 solution or potentially even as a lipid piggyback. But it's important for us to know that there's often 2 primary concentrations that people will be talking about when they're discussing intravenous lipid emulsions. The first of our 2 varieties of lipids is the 10% lipid solution. At this percentage, we'll see 1.1 kcals per milliliter, or a total of 100 grams of lipid per 1 liter of solution. So you can make your calculations based on the amount of grams of lipid you need, or you can make it based on the amount of calories you need from lipid. Similarly, we'll see a 20% lipid solution. Within this solution, you'll see that it's 2 kcals per milliliter, or you'll also see it written as 200 grams of lipid per 1 liter of solution. Depending on your institution, they will be the ones to help you determine whether or not you need to write this recommendation in the amount of kcals or in the amount of grams of lipid you'd like to provide. Also, you may see some institutions choose to only provide either the 10% or the 20% lipid, so make sure you're familiar with the offerings at your institution. One thing to know about intravenous lipid emulsions is that they actually contain 10 kcals per gram of lipid. So it's a touch higher than you would typically see in an oral or an enteral diet. And this is due to extra glycerol that's added to the formula. So make sure you take that into consideration when you're making calculations for your patients. Now that we've finished up our macronutrients, let's talk a little bit about micronutrients. Multivitamin and mineral solutions added into parenteral nutrition is very common. Within custom parenteral nutrition, you will likely just check the box to say, yes, please add the standard multivitamin/mineral solution into my parenteral nutrition so I can prevent any deficiencies in micronutrients for my patient. Within a standard bag, you may likely see it already mixed into the solution as the bag is likely ready to hang, so we're all good there. Some caution is necessary with patients who might have special concerns due to irregularly high or irregularly low micronutrient needs. For example, an individual who's an alcoholic might require additional thiamine supplementation that can be added into their parenteral nutrition. While you can add additional micronutrients into the PN bag, it doesn't always suit the needs of the patient and isn't always the best solution. So you may see a separate hanging solution of a specific group or single micronutrient that will be infusing externally from the PN bag. Don't be alarmed by this, but just know that this is a treatment option should there be something saying that the extra micronutrient should not be added to the parenteral nutrition, or maybe you've already just hung the parenteral nutrition bag and you don't have time to add the micronutrient anymore. So know there are multiple options when approaching micronutrients in parenteral nutrition. All right, let's chat about electrolytes. Whether or not an RD will manage electrolytes, or just lights for short, is based on hospital policy and protocol, RD skill set and comfort with making recommendations, and choice of parenteral nutrition used in-house, whether it's a standard or a custom bag. With a competent RD managing lights for a custom parenteral nutrition bag, they will make daily recommendations for what the lights they'd like to see added into the parenteral nutrition for the patient's best management. This is based on labs that are typically taken in the morning time that will allow for the dietitian to view what kind of electrolytes are currently in the person's system and then try and provide the amount of electrolytes needed to maintain appropriate balance within normal limits. Primarily, custom PN bags are meant to hang for 24 hours a day, meaning that you need to plan accordingly when you make lights recommendations for the entire next 24 hours. Should hospital policy state so, or if the RD does not feel comfortable, a pharmacist can also determine what lights will go into the bag of parenteral nutrition. With a standard bag of parenteral nutrition, lights are often already added at a standard level, and the bag should be ready to hang based on the hospital policy for hang time, with no need to make extra considerations for electrolytes. Well, we've made it to our last section, other additives. Most of the time in this category, we're talking about medications. Medications can sometimes be added to parenteral nutrition. Not every medication is appropriate to be added into this IV solution, but if the doctors on the team and the pharmacists on the team have determined that it would be appropriate to add the medication in, you may see them infusing within the parenteral nutrition. When we're talking about concerns with medications, we're oftentimes looking for something called a precipitate. The precipitate itself can be from any strange interaction between certain chemicals in the parenteral nutrition solution. They could happen from the medication, or they could happen from other things in solution. So make sure to kind of keep this in mind just as you continue to provide parenteral nutrition support to your patients. This can be anything from a cloudiness to kind of a grittiness or sediment type thing at the bottom of a parenteral nutrition bag. So if you see anything that seems strange, particularly within the clear 2-in-1 bags, you may want to bring it up to your care team. It's a little more difficult to see a precipitate within a 3-in-1 solution, being that the lipids are particularly kind of cloudy in themselves. So if you see any concerns, it's likely to happen in a 2-in-1, but we'll keep our eyes open for issues with 3-in-1 solutions as well. Overall, of course, this is the entire care team's responsibility to make sure our patient is getting the best care possible, including their parenteral nutrition and any medications that could be provided through it. So, keeping an extra eye out for what it looks like and making sure it's infusing appropriately is always important. I hope this video has been helpful for you as we've introduced what you might see in a bag of parenteral nutrition. If you have any comments or questions, please don't forget to leave them in the boxes below. And if you like what you saw, please don't forget to like our video and subscribe to our channel for more updates on parenteral nutrition, including case studies coming in the future. Take care, and we'll see you next time.